Wash your hands and introduce yourself.
And then what?
Wash your hands.
Check my patient's identifiers.
Put up your bed.
Huh?
Put up the bed.
First, before I put up the bed, what am I going to do? Tell the patient, introduce myself, tell the patient what I'm going to do. So, Mrs. Garcia, I'm here to put in a Foley catheter today. The doctor's ordered to have a Foley catheter so we can monitor your urine output better. Did he talk to you about that today?
No.
Okay, well, a Foley catheter is a sterile catheter that's going to go inside your bladder and drain the urine out. It's very important that this procedure is done sterilely, and that means super clean, so that you don't have any microorganisms or bacteria get in your bladder that's going to cause you to have a urinary tract infection. So I'm going to ask you to do a few things for me when I do this. The first thing I'm going to need to do is I'm going to need to clean your perineal area with soap and water. That's going to help eliminate some of the microbes that are down there, so that microorganisms that we all have down there, so that it will decrease your risk for infection. And then after I clean it, I'm going to be creating what we call a sterile field, was an area where everything is very, very clean. And when I have that sterile field, I'm going to tell you about that. And during that time, I want you to be extra careful not to do what we call contaminate the field or touch anything. Does that sound good, Mrs. Garcia? Do you think you can do that for me? Yes. Okay, so first thing, I'm going to get my equipment. I'm going to have for my peri-care, water, and towels. I'm going to raise the bed up to a working order. I'm going to wash my hands, get some gloves. God, I'm glad you guys are wearing gloves. I've been going through them like crazy.
Are we doing this just on female, or is there going to be male ones as well?
Okay, so you're going to do either male or female. I'm going to demo on both of them.
Okay.
If you do the female, you're going to tell us how you would do the male differently. If you do the male, you're going to tell us how you would do the female differently. So you're really going to be checked off on both, but the sterile technique, we're only going to be doing once. Okay. So I have my gloves on. I want to promote patient privacy, so I'm going to make sure the door is closed. I'm going to make sure that the curtain is drawn. Okay. And honestly, I've never seen that diamond drape used in the hospital. I personally think it makes it more awkward for the patient to hold their legs open. Okay, but I still use like extra towels and stuff to make sure that I promote privacy. Okay. So I don't just leave them open, okay? I'll put a towel or a bath blanket over their waist so that I only have to expose the area that I'm cleaning, because that's what makes the patient feel comfortable, and that's what promotes patient privacy. Okay? So I'm going to have my washcloth, and whether or not it is you use the mitt method or the banana peel method, it doesn't really matter, okay? But the point is that you're using a separate part of the washcloth for each part of the body, right? Why is that so important? Right, because I'm trying to remove microbes, okay? And so if I remove microbes, then there's microbes here. If I use the other side, then I'm removing more microbes instead of spreading microbes back onto the skin. So I'm trying to reduce the number. That's what I do. So I'll get my washcloth, make my mitt. I'm going to clean the thighs first, one side, other side. Get a new washcloth. Going to rinse both sides, dry. Do the other thigh. And then after those have been rinsed and dried, then I'm going to go into the genital area. So I'm going to expose it. And I will clean away from me first the outer labias. Okay? And then the area close to me, and then down the middle. Okay. So what's the rationale for that? Okay. So remember, when we're cleaning things, usually we're going from most dirty to cleanest, right? We're trying to get rid of the dirt. Okay. In this case, when we're sterile and we get in the habit of cleaning away from us first, then towards us, and then down the middle, it's so that we're not crossing that field. If we did the side closest to me, then I'd be crossing over it, right? So when we're just cleaning and doing pericare, it's not really as important, except for if I do everything the same way, it's kind of more consistency, right? In reality, in practice, what you're going to see us really do is kind of go from the dirtiest area to the cleanest area. So if I'm doing pericare because my patient's incontinent and I have more stool on this side than I have this side, I'm going to get rid of the dirtiest stuff first, okay? Because the rationale there is to move from dirtiest to cleanest, right? And getting everything clean. Okay. So, usually. When we're doing hygiene, right? That area, getting rid of all the dirt. Because if I clean this side really nice and there's poo over here, the poo's going to get over here. Does that make sense? Okay. So now I've done my pericare. Now the importance, then I'm going to do the inner labia. Okay, so I have a new washcloth. Okay, one piece of the washcloth. I'm going to spread the labia minora apart. Again, cleaning the far side for me, the close side to me, and then down the middle. Down the middle is because that's the part we want to be the cleanest at the last stroke. Okay, so after I've cleaned and dried that area, when I'm doing this, the reason why we need to do pericare before we do a Foley, okay, is that one reason we need to get rid of some of those microbes, right? We don't know when the last time they had pericare. It's really a horrible thing to get in there, be all sterile, and you're trying to put a Foley catheter in, and you spread apart the labia, and there's a bunch of crud there. Okay, we already talked about how hospital-acquired infections are not going to be acquired, and if I'm putting a catheter through crud into the bladder, what do you think is going to happen?
Crud's gonna get
Yeah, it's going to be a cruddy situation. Okay. So, the other good thing about, besides eliminating the microbes, is that everybody's anatomy is different. Okay, believe it or not, everybody's not going to be as tight and firm as Mrs. Garcia is. Okay, she's a mannequin, she's plastic. Okay, so everybody's anatomy is different. Not just one's a male, one's a female. Every male and female anatomy is different from any other male and female anatomy. So you need to go in there and investigate and see where you're going to go. Have a bit of a heads up so there's no surprises. Okay. Make sure that they don't have labial adhesions. Can you even spread the labia apart? That's a problem we have a lot of times in children. Okay. You know, do they have some unusual piercing down there that's going to get in your way? So now it needs to be removed before you put in a Foley catheter. So there's a lot of reasons. We're scouting out the zone, making sure that everything, we know what we're looking for. The meatus can be difficult to find, especially on the female. So we want to make sure we kind of know where we're going. Okay. So while I was cleaning, I was really assessing and investigating and seeing what things looked like. Okay. So so now I'm clean, I'm dry, and I'm ready to get ready for my sterile procedure.